If you are 62, 63, 64, chances are you are literally limping along trying to get to that magic age of Medicare eligibility to go get all your stuff fixed. You're not alone. Many people across the country decided, I have a $5,000 to $15,000 deductible. I'd rather not pay that. I think I'll wait till I get on Medicare. I know all my aunts and uncles did it, and my mom did it. And, if you can get through the pain and discomfort to get to Medicare, it generally does pay off, okay? So the key is, can you get through there? So is it bad to wait to get all your stuff fixed when you turn 65 and go on Medicare? And 65 is not the magic age. 65 or later, whenever you retire and stop being on your employer group health plan. So we'll just say in general 65. Well, I'm not a doctor, but I can tell you from working with thousands of seniors that if you need a knee or a hip at 62 and you want to sneak through to 65, you might be really exacerbating the condition. And I can think of a few people personally that because they limped for those 3 years, because they didn't want to pay their deductible, they not only needed a new knee, which they knew they were going to need a knee, but then they needed a hip because they kept overcompensating and they wore away on their hip. Where if they would have just bought the billet on the knee, they would have only needed a partial knee or a much simpler surgery, and they wouldn't have damaged their hip at all. So like I said, I'm not an orthopedic surgeon, but I play one on YouTube. So I will throw that out there. But I'm just saying in general, from my area of expertise in the insurance field, is it bad? Does it hurt you? No. When you first turn 65, they can't ask you about your health, first of all. So they can't say, hey, by the way, do you need 2 knees and 2 hips and a hysterectomy and a million other things? They can't ask you that. So the fact that you do need all those, they won't raise your rates or bar you from entry. Now you're on your plan and you can go schedule all your stuff and stay on your plan. They can't charge you more because you've overutilized your insurance. Okay? Now, if you do need to change plans because maybe you bought a bad plan, and I don't even know if I should say a bad plan. Maybe you made an unwise choice and you bought the cheapest Medicare supplement plan you could buy. And a rule of thumb is, if it's the cheapest, it might be not necessarily the best plan. And by best, I'm not talking benefits, because your benefits on a Plan G are all going to be the same. Your benefits on a Plan F, they're going to be the same. It's standardized by the government. Best, worst, when I'm using that lingo, I'm talking about the ability to maintain their rates. So if the prices here are all similar and the one's really low, maybe don't buy that really low one, because that really low one oftentimes is artificially low to get you in the door. And as soon as you're in, boom, they're going to zoom up here over the next 3 to 5 years, much higher than the rest of the market. And since you have had a lot of surgeries, you're no longer eligible to move to the competing plans that are down here at this average price range, because they're going to ask you underwriting questions after your initial entry into a Medicare supplement. Don't do it on Medicare Advantage, just on a Medicare supplement. I would favor a Medicare supplement over a Medicare Advantage if you do need a lot of stuff. If you know you need 2 hips and a knee and this and that and the other, start off with a Medicare supplement. Very low out of pocket, okay? If you buy a Plan G, you have $200 out of pocket for your deductible or less, depending on the year that you do it. And then you're not going to have other copays, coinsurance, in-network, out-of-network costs. It's beautiful. It is the new Cadillac plan. So start with a Medicare supplement, and you're not limited to any network. Just get all your stuff taken care of. Then if your rates start to go up, which they will, and you're uncomfortable with the rates because they hurt, or you see that your rates are much higher than all the competing rates, you can always move to Medicare Advantage because they're not going to bar you because you just had 2 knee surgeries and you still need a hip surgery. You got to space this stuff out. So if you have more questions, which I'm sure you will, those of you that have been limping towards Medicare age and trying to figure out, is it worth it to wait another year or two? Give us a call. We're happy to help. Email us, ask us questions in the comments, or call us. It never costs money to work with our specialists. My family here at the Medicare Family would love to help you and your family.